Hello. It's aka MODISHYE, and today I'm going to share 16 things that happens the evening of and the day after upper and lower jaw surgery. One, let's start off with the night of surgery. As mentioned in this video right here, my throat was sore. In addition to the soreness and being half awake and half asleep due to the weaning off of anesthesia, I had blood coming out from both my nose and my mouth. I remember one of the nurses who was trying to clean the blood from my nose and mouth repeatedly saying, "Open your eyes, Miss Talabi, open your eyes." I was quite dizzy and my eyes desperately wanted to relax. 2. During surgery, someone from the anesthesiology group will sometimes place an anti-nausea patch behind your ear. It is okay to remove it after 3 days. 3. You'll be hooked to an IV to receive the necessary fluids. Speaking of IVs, make sure to drink lots of water before midnight on the day of surgery. It helps to locate your veins more quickly in pre-op. In pre-op, they will request a urine sample, so you have something to give if you drink plenty of water the night before. The night before, I was so preoccupied with the plantain chips that I neglected to focus on my water intake. This was not my case, but if you cannot give a urine sample, they will have to stick you instead to give a blood sample. 4. Someone will place these kind of devices on your legs, and you will wear them until you leave the hospital. It's used to prevent blood clots. They are called intermittent pneumatic compression devices. Since I'm aware of my privilege of having a mother in the medical field with many years of experience, I will simplify it and mention the acronym because let's be for real. They are properly known as IPC devices in the medical field. Nonetheless, if you hear IPC next time, you will know what they are referring to. If you download my free packing list for jaw surgery, the IPC device is equivalent to the leg massager for circulation that you can purchase on Amazon. I suggest you purchase it because even though the oral surgeon ordered the IPC devices and they were placed on me after surgery, I couldn't go home with them. So I have added it to the list so you can use it after you leave the hospital. I use mine consecutively for about 4 to 5 weeks. Also, the oral surgeon ought to order the IPC devices in advance so you can wear them during your overnight stay. However, if for some reason he or she forgets, you now know to ask for them. 5. If you remember in this video right here, I mentioned how morphine will be used to help with the pain. If you develop a headache or other side effects from it, tell the nurse on duty so that you can reduce the dose or ask the doctor for an alternative. Remember to advocate for yourself because when you go home, you are on your own. It is a business and it is a transactional relationship. Do not think otherwise. Speaking of advocating for yourself, I have created a digital track list called Jaw Track. Jaw Track helps you stay organized by tracking important tasks before and after each appointment and monitor crucial changes as you recover. With Jaw Track, you can jot down your questions to ask at your next appointment, and doing this is one way how you can advocate for yourself. If this is something that you'll be interested in, purchase yours down below in the description box. 6. The next day, the oral surgeon will come by in the morning, at least mine did, to specifically check the swelling and assess the level of pain you are experiencing. I was told that I looked great. This was considered great. The oral surgeon will also use this time to open your mouth with a silver and cold instrument. Brace yourself, it will hurt because the oral surgeon uses the instrument to widen your mouth. This is also the time to ask questions for 3 reasons. If you remember in this video here, I mentioned how you want to use your vocal cords before you leave the hospital to help with the soreness and how it is uncomfortable at first. The more you use it, the likelihood the discomfort will go away. So that is the first reason. The second thing is this surgery costs more than 6 figures. The oral surgeon can create the time to answer your questions. They need you because you are the patient and you pay their salary. If that sounds too harsh, well, I suggest you remember that the relationship you have with the doctor is transactional. They are there to provide a service and get paid. They understand this. Do you? If you don't think so, receive your hospital bill and report back to me about how concerned they are with you then. When you go to the store and you cannot find something, you ask a sales associate for assistance, and they help you because it is their job. It is within a doctor's job description to answer your questions, so ask them. Don't offload that work to a nurse or a clinical coordinator when the doctor is right in front of you. Ask the doctor. The nurses don't get paid enough to do the runaround anyway. Also, as a patient, you only have to be breathing for the nurses to administer medicine that relieve your pain. So it is probably best not to get on their bad side. Your doctor writes the order for the nurse to give you the medicine, but they go home to their respective homes at night. The third reason why you want to ask the doctor questions is that if you can ask questions in that kind of environment where the stakes are so low, when the stakes are higher, you will have the data, as Michelle and Lester likes to say, oh, I've done this before, and therefore I can ask a question in a work meeting and so forth. 7. I did laps around the unit to get out of bed and move my legs. Since the surgery occurred during the summer, the sun was out and it was nice to see some sunshine. 8. The next day, I still had blood coming out from my nose and mouth, so that needed to be suctioned out. While trying to discard the dried nasal mucus, I would suggest using the items from your packing list, such as Vaseline and a cotton swab, to gently remove. Do not forcefully insert and do not blow. The oral surgeon instructed me not to blow. Also, since the sides of your mouth will be quite dry, I also suggest using Vaseline there. I did this periodically, and even after a week, I had noticeable cracks, as you can see here, due to lack of moisture on those sides. That's normal considering I couldn't open my mouth very wide. Thank you to my mom for sharing these tips about the Vaseline. I thought it was worth sharing because oral surgeons and most surgeons are more concerned with the mechanics of the surgery, and they may overlook these details or not think they are significant to share, especially when another factor called biological sex comes into play. The likelihood can become even slimmer. However, just because we had surgery does not mean we can let ourselves go. Let's move on to the next one. Number 9, I could not breathe from my nose, so I used my mouth instead. 10, there was a significant amount of pressure on the lower jaw. 11, I was given the approval to brush my teeth. This is where the baby toothbrush comes in handy because, like you, I was not able to open my mouth very wide. I had rubber bands. Do not cut the rubber bands. They should not come off so easily anyway. You will brush your teeth with them on at least until your next visit with the oral surgeon. 12. The oral surgeon asked me if I was ready to go home. I said yes. The IV had to go. Now, depending on your pain levels and other factors, you might have to spend an additional night. I understand the haste to get back to your own bed and environment. You might also be thinking that the cost of an additional stay is not what I budgeted for, and it is a major factor that can impact my stress level and potentially keep me up at night because I am barely surviving as it is now. To that, I say that I agree that upper and lower jaw surgery is quite expensive. I share some numbers, some larger than others in this video right here. Payment plans exist, so make use of them. And in that video, I mentioned how you might be able to get your bill lowered when you speak to someone from the billing department. These are the practical steps you can do, and leave the rest to God. He can make favorable outcomes a reality once you do your own part, of course. I know from personal experience, which is why I have 2 blog posts that discuss how favoritism was displayed at college, work, and at boarding school. Check them down below in the description box. Plus, increasing your stress level will not lower the cost of this procedure. Hospitals set their prices high for a reason. So I would suggest that you farabale, as we would say in Yoruba. In English, that means take your time. exercise patience, proceed with caution. If my mom was not a nurse or the oral surgeon said, Miss Talabi, the swelling and bleeding is concerning, I advise you to stay one more night, I would have. Saying that, and some might even say what I'm going to say next is contradicting, but I can assure you it is not. And that is, dear patients, get out of that hospital as soon as possible. That place is gloomy and there is very little to do in that environment. The nurses and nurse assistants are understaffed, overworked, and underpaid. Do yourself a favor and leave as soon as you are authorized to do so, of course. Heed the advice of your medical professional, as I am not. 13, the oral surgeon asked the nutritionist to come by. Honestly, it was 15 minutes and $35 that could have been allocated elsewhere, such as increasing the salary budget for nurses or having it completely omitted from my bill as far as I'm concerned. Because the advice the nutritionist gave, the oral surgeon told me earlier, and in fact, the oral surgeon told my mom and I where we could get the boost. By the way, you can find it on Amazon. The oral surgeon mentioned Costco, but we ordered the boost juice from Amazon, and I'll leave the link down below in case Costco is not found in your country of residence. The nutritionist did not even mention that. When you have jaw surgery, your nutritional options are few anyway, so I don't need 15 minutes to tell me all I can drink is boost and water for a significant period of time. 14. Speaking of diets, because your options are limited, irregular bowel movements are common. To solve that problem, Miralax was suggested by the oral surgeon. If you want to know more useful items to buy before jaw surgery, get my free jaw surgery pack list by signing up for my newsletter down below. 15, something which doesn't specifically pertain to the patient's recovery, but it has come to my attention that visitors may be unaware that hospitals and staffs are not obligated to provide comfort and nutrition to patients' family members, friends, acquaintances, and so on. To mitigate confusion or disappointment, I suggest that the patient share this video and inform visitors before they arrive at the hospital to bring their own blankets, pillow, and food. 16, if someone does come by to visit you, let it be someone who can advocate on your behalf and pick up your medicine before you leave the hospital. Your doctor should have sent the order to your chosen pharmacy. This is not the time to be useless or have people there just for show. I am quite fortunate that my mom was in the hospital with me, who not only performed tasks when the nurse on duty stepped away, but was present and could sense something was wrong and demanded I get the attention I needed. That sounds a bit vague, so I will share 2 specific examples that happened while I was in the hospital. My mom stepped out to get something to eat after she had been near my side all night, and the next day prior to taking a break. I was told by the nurse if I needed help, I should press the button and someone will come. Well, while my mom stepped out, I, mind you, was extremely fatigued as the anesthesia wore off and weak from the jaw surgery, as you can imagine. So such meant I was not fully alert and agile as I normally am. I pressed what I thought was the button several times, but no one came. I am not sure for how long I kept trying, but I do know it was long enough for frustration to come over due to abandonment. My mom came back and she found me in tears, and without hesitation, she got assistance. The time I complained about my headache from the morphine, which I mentioned earlier, I voiced my concerns, but my mom re-emphasized it to the oral surgeon. This is what I mean when I say invite someone who is going to speak up for you during such a delicate time. And if they can't and do not have the intuition to do so, do not tell them anything. They won't serve a purpose, and frankly, they will just take up space. If you like this video on what happens after surgery while you are still in the hospital, please like, subscribe to the channel for more jaw surgery videos, and hit the notification bell so you won't miss another video. If you missed the video that discusses what happens 30 days before upper and lower jaw surgery, watch it right here. Thank you so much for listening, and I'll see you in the next video. See ya!